Today we're going to talk about one of the two main types of inflammatory bowel disease, and today we're going to talk about UC.
What? You see?
Yeah, UC.
I can't see, I can only hear you.
We're talking about UC, man. Ulcerative colitis. Just get off the mic, man. Get off the walkie. Ulcerative colitis, one of the two main types of inflammatory bowel disease. The other one is Crohn's disease, which we will talk about another time. Ulcerative colitis classically affects the large bowel and to a lesser degree sometimes the small bowel, the tail end of it. It's a chronic illness, unfortunately. So who gets it? Well, there's a genetic element to it, environmental. Also, if people use certain painkillers, can increase the chance of having it. So why is this thing so important? Well, apart from the fact that it can really affect your daily function, by which I mean signs and symptoms include things like diarrhea, rectal bleeding, abdominal pain, weight loss, flatulence, bloating, to name but a few. Apart from these symptoms, continuous activity, inflammation going on for a longer period of time, meaning if you had it from a younger age or higher chance in men as well, the chances of colonic cancer does increase. So apart from the fact that it changes your lifestyle, in the sense you can't go and enjoy yourself, cancer is. That's the big one there. So how do you diagnose it? Well, if you have any of those mentioned symptoms or signs, you got to go see your gastroenterologist. What you're going to have? You're going to have a colonoscopy, and that will give you your diagnosis. Well, of course, this could look like so many things else, and so many things else can look like this. What other things can it be apart from ulcerative colitis? Well, it could be TB, it could be colorectal cancer, it could be infective diarrhea, to name a few. So if you have ulcerative colitis, what do you need to do? Well, the treatment for it is primarily medicines. You start with steroid medicines, then things like mesalazine, azathioprine, and then biologic medication going up the scale. Now, it's important to remember, these things are less common in Asia compared to the Western society. Also, they tend to be less severe in Asian countries, though the frequency is increasing and severity to go with it. Now, what if medicines don't work for you? What happens then? Then you need to see your friendly surgeon, which unfortunately means operations. So if you have those above mentioned symptoms or signs, and it's still not getting better, you may have ulcerative colitis. And if you do, you gotta see your gastroenterologist, because we want to keep the knives away from you. Oh yes, there is one other thing. With inflammatory bowel disease, particularly in ulcerative colitis, which we are talking about now, you don't only just have colonic symptoms. You can get extra colonic manifestations, meaning it can also affect your liver. You can get conditions such as PSC, you can get skin disorders, as well as arthritis. If you have any of these symptoms that's not primarily colonic, you still got to think ulcerative colitis. Or at least your doctors will do. Ulcerative colitis, it doesn't have to control your life. Take back control. UC means ulcerative colitis. Did you get that, man? Ulcerative colitis. No, colitis. Yeah, listen, just, Ulcerative colitis, UC. You got it?
I don't see. I still don't see.